Welcome to CHEO's informational video on adenoidectomy surgery. Hi, I'm Emily, here to enhance your learning experience. This video uses the knowledge and experience of CHEO's experts. This overview explains your upcoming adenoidectomy surgery, a procedure to remove the adenoid tissue located behind the nose. You may need this surgery if you have obstructive sleep apnea, if you require multiple sets of ear tubes, if you have chronic sinusitis, or if there are significant dental or speech concerns related to enlarged adenoids. This surgery lasts about 20 minutes and is performed under general anesthesia with a breathing tube. After surgery, you will be woken up and brought to the recovery room. Most patients go home the day of surgery. Recovery from this surgery takes approximately 1 week. Stay home from daycare or school for 5 to 7 days and avoid intense physical activity and sports for 2 weeks. After this 2-week period, you can resume normal activities. There are no dietary restrictions following this surgery. However, you should stay well hydrated. Most children experience pain after this surgery, so please ensure you have liquid or chewable Tylenol at home. Tylenol will be given for 7 to 10 days after the surgery, as well as a prescribed medication called Celebrex, which will also work to reduce pain. It is important that you do not give aspirin, Advil, or other blood-thinning medications 1 week before and 2 weeks after surgery. Now I'd like to go over the risks of the procedure. There is a 1 to 2% chance of bleeding after surgery. You may see small specks of dark blood from the nose or in the saliva, but any more than a teaspoon of bright red blood requires a trip to the emergency room for prompt evaluation and treatment. Vomiting blood also requires emergency attention. Emergency surgery to stop the bleeding may be necessary, and this can occur anytime during the 2-week postoperative period. In some rare cases, persistent pain, stiff neck, and fever can occur following adenoidectomy, which requires prompt evaluation by a physician. After the surgery, it may sound as if your child is talking through the nose. You may notice liquids coming out of the nose when your child is drinking fluids. This is common if the adenoids were very large prior to their removal, but usually resolves within 3 months. There is also a risk of adenoid regrowth in younger children. Other risks of this surgery include loosening or chipping of teeth, injury to the lips, infection at the surgery site, and dehydration. Adenoidectomy is a common surgery at CHEO, and we look forward to supporting you and your family through this experience.